All right, that's great. Good afternoon. I'd like to thank Susan and the organizing committee and all the wonderful people who are help making these sessions run so smoothly. I'm with Canadian Center for Men and Families, York Region, which is a men's mental health agency just north of Toronto. And what I'd like to do is to share our story and some of the lessons we learned in terms of how to provide very effective mental health service to clients as a startup. Thank you. So I'd like to start just telling you a little bit about our story, what were the driving forces behind CCMF York. Next, please. So in about 2008, this was an event that really, really disturbed me. This man ran a van through a whole bunch of victims, mostly women. And what it really made me think was that what happens when men fail and a tremendous cost they have to the society. Next, please. The second was this was in the spring of 2019. This paper came out written by Dr. Isova and her colleagues that for the first time using the General Social Survey of Victimization, this is done by Stats Canada every 5 years. For the first time, it highlighted the prevalence of domestic abuse male victims in Canada. Next, please. And lastly, there was the data on the impact of divorce on men and their children. That really, what is the impact on both in terms of the statistics? Next, please. So we know about 35% of marriages end in divorce, and divorce is the most significant and most common factor for loss of a parent at a young age. It is also, and this is a paper that came out not too long ago, that it's a second most significant non-medical risk factor for mortality, especially for men. So suicide rate for men after divorce is about 8 times that of women. And this gender gap really, really got me. Next, please. Next, please. So about 78% of children in Canada are not in a shared parenting time and decision-making arrangement after divorce. This is the data is about 5 years old, but my understand it's not a whole lot improved since then. These children generally are not able to form a meaningful relationship with the non-residential parents, usually the fathers. Now, this is a number that really got me. Children in homes without a dad, I'm not including the LGBT community, it's a little bit different, are they have the 4 times the suicide rate than their peers in a 2-parent family. 85 to 90% of the incarcerated youth do come from dads, the families that there are no dads. Same with the homeless and runaway teenagers. It is a most significant risk factor for children and youth engaging in drug use. And it, in fact, doubles a child's chance of dropping out of high school. And of course, it is known that it has teenage pregnancy is much higher for in families that there are no dads. Next, please. So what happened, what it highlighted is that these have impact on the victim, and not only, but also, next, but also on their families, and next, on the higher impact on the greater society. Next, please. So the question really was, where do these men go to get support for trauma, such as domestic abuse and also other life challenges? So the data I showed from Lisovo et al., I sort of did a calculation in terms of the percentage of men versus women, and considering the age of different categories, I came up about 47,000 men in Canada are impacted by domestic abuse. I did a calculation for York region where we live, and that was about 1,200 per year. So in spring of 2019, I sort of did embark on an environmental scan of York region that was speaking with domestic violence unit in the York Region Police, various agency leaderships, and found out that really there's really nothing for men to help them in this difficult situation. And who need support when experiencing trauma. Next, please. In July of 2019, I found CCMF Toronto and approached them and asked them whether they'd be willing to allow me to open a branch in York region. Next, please. And they said yes. We had our things then after that happened very, very quickly. We opened, we approached a church. They gave us a little space, and we had our first client on a December of the same year. Next, please. And of course, in September of last year, we got a large donation, and we were able to open our offices in Richmond Hill in a very attractive office space. Next, please. We experienced a very significant intake growth right away. Last year, we had about 80% increase versus the year before, which was our first year in full time, a full time that we were serving for the full year. And this year, we already exceeding that versus last year as well. So very strong growth for what we are providing as service. Next, please. Our clients come to us for a number of reasons. Domestic abuse is a vast majority, 41% physical abuse, emotional abuse, 89%, parental alienation, 37%, financial abuse, 41%, sexual abuse, 26%, false allegations, 48%, and other is 11%. And my experience, since I was actually doing the intakes for the first year of we had this agency open, I found those two to be the most devastating forms of domestic abuse. Very difficult. This is where you see middle-aged men just crying from what was happening, and it was very difficult to listen to. Next, please. We had a number of success factors that helped us to do what we did. These were really the pillars of our strategy to make a difference. Next, please. Well, number one, provide support. Very basic. So our psychotherapy has been the bread and butter of our services, and of course, we are very resource poor. So what we did was we told our therapists that, hey, look, we'll give you the office space, we'll give you tons of clients, give our clients a break, and they did. So we have what you can pay psychotherapy. Next, please. And so we have marriage counseling, anger management, various support groups, and in fact, there is a support group also for fathers to help them maintain relationship with their children after divorce, and that's actually we work very closely with our other branches, and some of these programs are offered through there as well. Next, please. Which we found extremely important was really we need to how to bring change, and that was through awareness with the social agency frontline workers and the public, because that's what you really need to make a difference. So before we opened the agency, and very, very extensively after, we had a lot of outreach with community and partner agencies to increase awareness for the male victim of domestic abuse, and in order to promote our services and also get referrals. And that's been working really, really well. So we get referrals from almost every major agency in our region. Next, please. And actually, just want to share a story. During the COVID, we had the phone was in our home, and Friday night, 6 o'clock, a phone rings. I pick it up, and it was somebody from a frontline agency, a frontline working in an agency, major agency, that actually said, "Can I refer a family member to you guys?" And so the trust from agencies has been absolutely incredible. Very heartwarming to get those sort of phone calls. Our One of the most effective tools for our for promoting our services being a webinar series, Men, Domestic Abuse and Trauma. It was developed and presented by Michael Healy from our agency, and we've had hundreds of people registering and attending those webinars. And they were not public; they were all frontline agencies, so frontline workers in agencies in York region and beyond. And every time we send it, we get a great response. The first time when we did that, we expected to about 10, 15 people. 30 people registered within 4 days. We had to close it after a week. And the next time, we got about 80 or 90 people register. And now we haven't done it for about a year. But last time we've done it, we sent one email a month before, and we get 100 people registering. So it's very popular. And of course, we made an effort to be part of various agency focus tables, and we get invited to those quite a bit. Next, please. One of the best things that I think we did, I come a little bit from an academic background, so I have a very strong affinity for academic work. And one of the best things that happened to us was really meeting Susan, for example, and we've had a very great relationship. And she found this cause very important, and she dived right in. We did a partnership grant, actually, the Social Sciences and Humanities Research Council grant, and that's been very successful. And the studies with those are ongoing. And with Doctors Lisova and Hines, we collaborated and they developed a police domestic abuse training course, which once it's almost ready, and when that's ready, we'll be ready to market that to police forces across Ontario. We've had some communications with police forces. They seem interested, and including Ontario Police College domestic violence training program. They're also interested to look at it. So we are very excited about this. Next, please. So of course, and lastly, we hope to bring change through advocacy and education. Next, please. This is a really good example. These are the data from York region, but it's the same. I'm pretty certain across Ontario. About 80% of domestic abuse, those who are charged are men. At the same time, about 50% of the victims are men. So there's a little bit of a disconnect between those numbers, and we've been in contact with York Region Police, and I don't know. I'm hoping that little dip could be it could be as a result of our conversation. I don't know. Next, please. So challenges funding. We have very little. We had a COVID funding, which was fantastic. We don't have any funding that we be able to reliable funding that we can count on at this point. Next, please. Future initiatives we are very excited is violence among men against men campaign, and what we're hoping to, and that's led by Sarita Lacher. And what we're hoping to do is to create more awareness about violence, that male victims of violence, not just by gender-based, but also in general. 78% of domestic of homicide victims are men, and a lot of those is done perpetrated by other men as well. So we are trying to take a big picture approach. Next, please. And another one is we're hoping to raise a public profile and discourse regarding false allegations and parental alienation. Hopefully, we'll be able to create an alliance of Academic Alliance to be able to force Stats Canada to include this data in the next general social survey. And once we have that, we'll be able to approach policymakers and bring real change. Next, please. So I'd like to acknowledge our staff, volunteers, practicum students, therapists, our operations committee, intake facilitators, other volunteers, donors, our academic partners have been absolutely indispensable to this work. And of course, CCMF National, our sister branches across the country. And of course, I mentioned already the donors. Next, please. And thank you for your attention. And I'll be happy to get any questions, I guess, after the next.